She made $80 million from my work. I made nothing. Then I destroyed her everything.
I sat in the back row of the Georgetown Medical Innovation Conference, watching Dr. Rebecca Walsh, my mentor, my lab partner, my friend, present my insulin delivery device to 2,000 researchers and a room full of pharmaceutical investors. And I felt my entire world collapse into a single, suffocating moment of understanding. She was wearing the navy suit I'd helped her pick out last month. We'd spent an afternoon at Nordstrom, me offering opinions while she tried on options. Both of us laughing about how much we hated shopping, but how important it was to look professional for big presentations. The memory felt poisonous now. The PowerPoint behind her displayed my diagrams, my calculations, my 3 years of 18-hour days and missed holidays and skipped meals. But every slide had one name in the corner: Rebecca Walsh, PhD, Principal Investigator. My name appeared once in 8-point font on the acknowledgement slide, buried between the lab janitor and the equipment supplier. The glucose-responsive polymer matrix represents a paradigm shift in diabetes management, Rebecca said, her voice carrying that warm authority that had made me trust her in the first place. She kept saying we, but her patent application, which I'd discovered 2 hours earlier in a forwarded email that wasn't meant for me, listed her as sole inventor. Every technical breakthrough I'd made over 3 years, every late night when I'd finally cracked another piece of the puzzle while Rebecca was home with her family, all of it belonged to her now. My hands were shaking. I pressed them flat against my thighs, trying to focus on my breathing the way my therapist had taught me. But the technique felt useless against the tidal wave of betrayal crushing my chest. Around me, researchers were taking notes, nodding appreciatively. A venture capitalist in the row ahead was typing rapidly on his phone. Nobody knew they were watching intellectual theft happening in real time. The worst part was remembering all the times Rebecca had praised my work in private while keeping me invisible in public. All the times I'd stayed late at the lab while she left early, trusting her to handle the administrative side while I focused on the science. All the times I'd explained a breakthrough to her and watched her eyes light up with what I'd thought was pride in my accomplishment. I'd been so naive, so desperate to believe that someone brilliant and established actually saw my potential. Rebecca advanced to the next slide, my prototype design, rendered in clean 3D graphics that made 3 years of messy trial and error look effortless. Preclinical trials show a 94% improvement in glycemic control compared to traditional pump therapy, she continued. We're currently in discussions with Meridian Pharmaceuticals for commercial development and distribution. Meridian Pharmaceuticals, an $80 million deal, according to the email I'd seen. She was selling my work, my life's purpose, and I wouldn't see a single dollar. Worse, she was using my patient impact projections, the calculations I'd stayed up until 3 a.m. perfecting, because I wanted to show exactly how many lives this technology could change. I stood up, my chair scraping loudly against the conference hall floor. Several heads turned. Rebecca's eyes found mine across the crowd, and for just a second, I saw something flicker across her face. Not guilt, recognition maybe. The look of someone who'd been caught but wasn't sure yet if it mattered. I walked out of the auditorium into the bright corridor, the hotel's generic floral carpet blurring beneath my feet. My reflection in the glass doors looked like a stranger. A 34-year-old woman in a blazer she couldn't afford, with dark circles under her eyes from years of sleep deprivation in service of a dream that was being stolen while she watched. My phone buzzed. A text from Rebecca. "Where did you go? We should celebrate after. This is huge for us." For us. I wanted to laugh, but I was afraid if I started, I'd never stop. I'd come to this conference thinking I was supporting my mentor's presentation of our joint work. I'd helped her rehearse the night before, suggested better ways to explain the polymer chemistry, reminded her to emphasize the patient impact. She'd thanked me, bought me dinner at an expensive restaurant I never could have afforded on my fellowship stipend, told me she couldn't have done any of this without me. That part, at least, was true. 3 years earlier, I'd joined Rebecca's lab at Georgetown Medical Center with a fellowship that barely covered my rent in a basement apartment in Arlington. The apartment had a persistent mold problem and a landlord who never fixed anything, but it was all I could afford on $35,000 a year in one of the most expensive cities in America. She was already a rising star, published in Nature, funded by the NIH, known for innovative approaches to biomedical engineering. When she'd offered me a position, my advisor had called it the opportunity of a lifetime. "You'll learn from the best," he'd said, shaking my hand with genuine enthusiasm. Rebecca has a gift for translating academic research into real-world applications. What he hadn't mentioned was that her gift involved taking other people's translations. I'd spent my first 6 months doing the grunt work every junior researcher does, running experiments, analyzing data, making coffee for lab meetings. But in the quiet hours after everyone else left, I'd started working on my own idea, a glucose-responsive insulin delivery system that could mimic a healthy pancreas's natural regulation. The technology existed in pieces: smart polymers, embedded sensors, miniaturized pumps, but nobody had figured out how to integrate them into something small enough and reliable enough for daily use. The problem fascinated me because my father had been diabetic. I'd watched him struggle with blood sugar management my entire childhood, seen him wake up disoriented from nighttime hypoglycemia, witnessed the constant burden of monitoring and calculating and adjusting. He'd died during my second year of grad school from complications that might have been prevented if he'd had better tools for glucose control. I'd shown Rebecca my early sketches hesitantly, expecting her to tell me it was too ambitious for a junior researcher. Instead, her eyes had lit up with an intensity I'd mistaken for excitement about my potential. "This is brilliant," she'd said, pulling my notebook closer across her desk. Her office had smelled like coffee and the lavender oil she used in a diffuser. "The polymer matrix approach. Nobody's thought of this." I'd felt validated in a way I hadn't since my father died. He'd been the one who believed I could make a real difference in medicine, who'd sat with me through late-night study sessions, who'd told me that being brilliant wasn't enough. You had to be brave enough to trust your own ideas. Rebecca had seemed like the mentor who could help me honor that legacy. "Let's develop this together," she'd said. "You focus on the technical design. That's clearly your strength. I'll handle the administrative overhead, the grant applications, the politics. You're too talented to waste time on bureaucracy." We'd shaken hands. I'd gone home that night feeling like I'd finally found my place in the academic world, that had always felt just slightly out of reach for a first-generation Nigerian-American woman whose parents had sacrificed everything for her education. Over the next 3 years, I'd poured every piece of myself into that device. I'd solved the polymer stability problem by synthesizing a new hydrogel matrix that could maintain its structural integrity across a wide range of pH and temperature conditions. I'd miniaturized the sensor array to fit within a patch smaller than a credit card, spending 6 months just perfecting the electrode placement. I'd designed the algorithm that allowed real-time dosing adjustments, teaching myself advanced programming on weekends because the lab couldn't afford to hire a software engineer. Every breakthrough had come during those late nights when I was alone in the lab, working by the light of my desk lamp while Rebecca's office stayed dark. She'd encouraged me to focus on perfecting the technology rather than worrying about publications or patents. "The science comes first," she'd said. "Recognition follows quality work." I'd believed her because I'd wanted to believe that the academic world could be fair, that hard work and brilliant ideas mattered more than politics and positioning. Now, sitting in a hotel bathroom stall while a conference proceeded without me, I finally understood what my father had tried to teach me. Being brilliant wasn't enough. You had to protect yourself from people who saw your brilliance as something they could take. My phone buzzed again. Another text from Rebecca. "Amara, where are you? Meridian's CEO wants to meet the team." The team. I was part of the team when it was convenient for her, invisible when it came to credit or compensation. I opened my email and reread the message that had shattered my world. Glucose Responsive Insulin Delivery System, Sole Inventor, Rebecca M. Walsh. Contributors, none listed. Assignee, Georgetown Medical Center. Estimated commercial value, $120 million. There was an attachment, the full patent application. I downloaded it with trembling hands and read every page, recognizing my own technical drawings, my polymer formulations, my design specifications, all presented as Rebecca's original work. She'd even included photographs of prototypes I'd built with my own hands, taken in the lab during late-night sessions when I'd thought I was working alone. She'd been documenting everything, building a portfolio of her work, while I'd been naive enough to think we were building something together. I pulled up Rebecca's faculty profile on my phone. Under recent publications, I saw 3 papers I'd never read before, papers from 5 and 7 years ago, each with a junior researcher listed as second or third author. I clicked through to the first paper's acknowledgement section and felt ice spread through my chest. The junior researcher, a woman named Dr. Jennifer Lynn, had thanked Dr. But a quick search showed Dr. Lynn had left academia entirely 3 years ago. Her LinkedIn profile said she was now a high school chemistry teacher in Ohio, her last academic position ending abruptly with no explanation. The second paper featured Dr. Marcus Thompson, whose acknowledgments credited Dr. Marcus Thompson's trail went cold after that publication. No subsequent papers, no current academic position, nothing. Rebecca had done this before. The pattern was clear now. Find brilliant junior researchers, earn their trust. Let them develop breakthrough technology while keeping them focused on perfecting the science. Then claim their work and push them out before they could fight back. I was just the latest in a series, but unlike Jennifer Lynn and Marcus Thompson, I had something they might not have had: evidence and a clear memory of every step of my development process. I'd kept detailed lab notebooks, dated and witnessed according to proper research protocols. My father had taught me that. Document everything, Amara. I'd saved every email, every sketch, every iteration of the design. I'd even kept the original handwritten calculations from the night I'd solved the polymer stability problem. Pages covered in my handwriting, dated 18 months before Rebecca had filed her patent. I stood up, splashed cold water on my face, and looked at my reflection in the bathroom mirror. My eyes were red but clear. The shock was fading, replaced by something sharper and more focused. Rebecca Walsh had made a mistake. She'd assumed I was like her previous victims, young, isolated, too intimidated by the academic hierarchy to fight back. She'd assumed that 3 years of carefully cultivated dependence and praise would keep me grateful and silent. She'd underestimated me. I walked back to the conference hall and slipped into my seat just as Rebecca was finishing her presentation. She saw me return and smiled, that warm, mentor knows best smile I'd once found so reassuring. Rebecca asked the audience. A venture capitalist in the front row raised his hand. The polymer matrix you've developed, can you walk us through the synthesis process? I watched Rebecca's smile tighten almost imperceptibly. She knew the synthesis process because I'd explained it to her a dozen times, drawn out the reaction mechanisms, walked her through the chemistry step by step. But she'd never actually done the work herself. The synthesis involves a novel cross-linking approach using bioorthogonal chemistry, she said, hitting the key buzzwords without providing real detail. She couldn't explain it. She'd stolen my work, but she didn't actually understand the science deeply enough to defend it under scrutiny. That was her second mistake. After the presentation, I followed Rebecca to the reception, watching her network with pharmaceutical executives and venture capitalists. The reception was being held in a ballroom with 2 bright chandeliers and tables covered in white cloth, servers circulating with wine and canapes that probably cost more than my monthly food budget. She introduced me to a few people as my brilliant research associate, a phrase that might have pleased me a week ago, but now felt like acid in my ears. Amara does exceptional work in the lab, Rebecca told a Meridian executive. Instrumental, like a tool she'd used. Dr. Okafor, the executive said, shaking my hand. His grip was firm, professional, the kind of handshake that came from a lifetime of closing deals. His business card identified him as VP of Research Partnerships. Before I could answer, Rebecca jumped in. Amara's been focusing on the optimization phase. Really valuable detail work. The executive nodded and turned back to Rebecca, dismissing me as a technician rather than the inventor. I felt the fury build behind my sternum, hot and sharp, but I kept my expression neutral. I'd learned something important in that moment. Rebecca had been doing this so long, the lies came reflexively. She probably half believed them herself. I excused myself and spent the next 3 hours in the hotel business center, a sterile room filled with computers and the hum of a tired air conditioning unit. I ran searches and made phone calls, my fingers flying across the keyboard with desperate efficiency. I found Dr. Jennifer Lynn's contact information through a university alumni database and sent a careful email. Dr. Lynn, my name is Dr. Amara Okafor. I'm currently working with Dr. Rebecca Walsh at Georgetown Medical Center. I came across your 2019 paper on antimicrobial peptides and was hoping to discuss your research. Would you be available for a brief call? I sent a similar message to Dr. Marcus Thompson, though his trail was harder to follow. His last known email bounced back, but I found a phone number linked to a biotech consulting firm where he'd briefly worked. Then I went back to my hotel room and began compiling everything. Every lab notebook entry, every email where I'd explained technical concepts to Rebecca, every dated sketch and calculation, every photograph of prototypes at various stages, with metadata showing when they were taken. The NIH grant application I'd drafted that Rebecca had submitted under her name. The conference abstract I'd written that she'd presented as her own. I worked through the night, ordering room service coffee at 3 a.m. when my eyes started to blur. The coffee was terrible, burnt and bitter, but it kept me awake. By dawn, I had a timeline document showing every major breakthrough in the insulin delivery device's development, each one tied to specific evidence with my name and timestamp attached. The pattern was irrefutable. Every innovation had originated with me, during periods when I was working alone, often late at night after Rebecca had gone home. My phone rang at 7 a.m. Dr. Jennifer Lin. "I got your email," she said without preamble. Her voice was cautious, carrying a weight that made my chest ache. "You're working with Rebecca Walsh." I sat up straighter, my exhaustion forgotten. I asked, "The same thing that's probably happening to you," Jennifer said. "I developed a new antimicrobial peptide synthesis method during my postdoc in her lab. Revolutionary approach, potential applications in resistant infections. Rebecca convinced me to hold off on publishing until we had more data. She said we needed to be absolutely certain before we put our names on something so significant. I trusted her. She was this brilliant, accomplished researcher, and I was just starting out." "She filed the patent herself," I said, already knowing the answer. "She published it with me listed as a minor contributor," Jennifer confirmed. "Filed a patent with her name as sole inventor. When I objected, when I showed people my lab notebooks proving I'd developed the core technology, she launched an investigation claiming I'd been fabricating data. It destroyed my reputation. No university would hire me after that. The investigation found irregularities in my notebooks, irregularities she'd planted by modifying my documentation while I was on vacation." I asked, my mind already racing through my own documentation, checking for vulnerabilities. "I'd been sloppy about getting witness signatures," Jennifer admitted, and I could hear the self-recrimination in her voice even 3 years later. "I trusted everyone in the lab. She waited until I was gone for a week, visiting my sick mother, then altered some entries to make it look like I'd backdated results. Small changes, but enough to call everything into question. Changed a few dates, altered some numbers. By the time I realized what had happened, the damage was done. My advisor sided with Rebecca. They'd collaborated for years, published together, brought in grants together." I asked. "I tried," Jennifer said, her voice bitter. "But she had the institutional backing, the reputation, the resources. I was just a postdoc who looked like I was making excuses for poor work." My advisor sided with Rebecca. They'd collaborated for years. Nobody wanted to believe that a renowned researcher would steal from a junior colleague. It was easier to believe I was lying. "I'm sorry," I said, meaning it deeply. I could hear the pain in her voice, still raw after 3 years. "Don't be sorry," Jennifer said, and I heard steel enter her tone. "Fight back. If you have evidence, fight. Don't let her do to you what she did to me." "I have evidence," I said. 3 years of it. Every notebook witnessed and dated. Every email saved. "Then burn her down," Jennifer said, "because she won't stop unless someone stops her. And Amara, when you do, call me. I want to help." I spent the next week building my case with the precision I usually reserved for scientific research. I contacted Marcus Thompson, who'd had a similar experience. Breakthrough work in targeted drug delivery stolen, and his career derailed when he questioned Rebecca's attribution. He'd left academia for industry and signed a settlement with a non-disclosure agreement, but he was willing to provide a deposition about the pattern of behavior if it could be done in a way that didn't violate his NDA. "She got me to sign away my rights," Marcus told me during our phone call. His voice was measured, controlled, but I could hear the anger underneath. "I was young, scared, broke. My student loans were crushing me. Her lawyer made it sound like fighting would destroy me, that I'd never work in science again. So I took their $50,000 and disappeared." I asked. "Because she's still out there, doing it to other people," Marcus said. "Doing it to you. And I could have stopped her if I'd been brave enough." "It wasn't about bravery," I said. "She had all the power, the institution, the reputation, the resources." "Maybe," Marcus said. "But now I have a chance to make a different decision." I printed every piece of documentation, organized chronologically in 3-inch binders that eventually filled 2 boxes. Lab notebooks with witness signatures from colleagues who'd seen my work in progress. Emails where I'd explained technical concepts to Rebecca, proving the knowledge originated with me. Metadata from photographs showing I'd taken them on specific dates in the lab after hours when only I had access. The original handwritten calculations for the polymer synthesis breakthrough with my distinctive handwriting and dated by a lab timestamp system. Financial records showing I'd purchased specialized equipment with my own money when the lab budget ran short. Conference presentations I'd drafted that Rebecca had delivered under her name. I contacted the university's patent office directly, requesting a meeting with the office director. I reached out to the NIH Office of Research Integrity, filing a formal complaint about potential misconduct. And I contacted Meridian Pharmaceuticals' legal department, informing them that their proposed acquisition involved disputed intellectual property and potential fraud. The responses came fast. The patent office director scheduled an emergency meeting. The NIH opened an investigation. Meridian's lawyers put the acquisition on hold pending review. Rebecca called me 3 days after I'd started this process. Her voice had lost all its warmth, replaced by something brittle and dangerous. "Amara, we need to talk." "I imagine there are," I said evenly. "I think there's been a misunderstanding," Rebecca said. "The patent process is complicated, and the lawyers often make decisions about attribution that don't reflect the collaborative nature of research." "This wasn't a collaborative decision," I said. "You filed a patent listing yourself as sole inventor for work I developed. That's not a misunderstanding." "Amara, you're young. You don't understand how academic credit works. The principal investigator—" "I understand perfectly," I interrupted. I also understand intellectual property law and patent fraud. Silence stretched between us, taut as a wire. Then, carefully, "You're making a serious mistake. Fighting this will damage your career more than mine. Nobody will want to hire a researcher who attacks her mentor." I asked, "And Marcus Thompson?" The silence that followed was different, heavier, shocked. She hadn't expected me to find them. "I'm offering you a chance to handle this quietly," Rebecca finally said. "We can discuss proper attribution, maybe add you as a co-inventor. I'll make sure you're included in the Meridian negotiations. But if you push this publicly, I will defend myself, and I have resources you don't. Legal resources, professional connections, institutional support. I will bury you, Amara." "We'll see," I said and hung up. My hands were shaking, adrenaline flooding my system. I'd just threatened a woman with the power to destroy my career, a woman who'd already destroyed others. But I'd also just stood up for myself in a way I'd never done before. It felt terrifying and right in equal measure. The university launched an investigation. The patent office put Rebecca's application on hold pending review. Meridian Pharmaceuticals suspended their acquisition discussions, their stock price dropping 3 points on the news of potential IP disputes. And Rebecca hired a lawyer who immediately sent me a cease and desist letter, claiming I was making defamatory statements and threatening my career. I hired my own lawyer, a woman named Patricia Chen, who specialized in intellectual property and scientific misconduct. She came recommended by Jennifer Lynn, who'd found her too late to save her own case, but had stayed in touch. Patricia reviewed my evidence over a weekend and called me Monday morning. "Dr. Okafor," she said, and I could hear the satisfaction in her voice. "This is the most clear-cut case of IP theft I've seen in 20 years. Your documentation is extraordinary." "My father taught me to document everything," I said. "He was an engineer." "Your father was a wise man," Patricia said. The deposition was held in a conference room at Georgetown's administrative building 2 weeks later. The room smelled like old coffee and industrial carpet cleaner, artificial light making everyone look slightly ill. Rebecca sat across from me with her lawyer, a sharp-suited man named Richard Westbrook, who'd clearly been told to intimidate me into backing down. He had that particular brand of aggressive confidence that came from winning too many cases against people with fewer resources. Patricia sat beside me, radiating calm competence in a way that made me believe we actually had a chance. "Dr. Okafor," Westbrook began, leaning back in his chair like he owned the room. "Can you describe your role in Dr. Rai?" I said carefully. "But you were working under Dr. Walsh provided lab space and administrative oversight," I said. Westbrook slid a document across the table. "This is the patent application filed by Dr. Walsh. As you can see, it lists her as the principal inventor. That's standard practice when—" "It's fraud," I interrupted. "Every technical element in that application was developed by me." For the next 4 hours, I walked through my evidence. Lab notebooks showing my work developing the polymer matrix, each entry witnessed by other lab members according to proper protocol. Emails where I'd explained the technical concepts to Rebecca after I'd solved them, with her responses asking basic clarifying questions that proved she hadn't understood the science initially. Photographs of prototypes I'd built, with metadata proving I'd taken them at specific times, always after hours when I was working alone. testimony from other lab members who'd witnessed my late-night work sessions and remembered me explaining breakthroughs the next morning. Westbrook tried to argue that all research conducted in a university lab belonged to the principal investigator. Patricia calmly cited case law proving that wasn't true. Attribution had to reflect actual intellectual contribution, and employment status didn't transfer invention rights. She had 3 precedents ready, all cases where junior researchers had successfully defended their intellectual property against senior colleagues who'd tried to claim credit. Dr. Rebecca began explaining, but within minutes she was getting details wrong. Basic chemistry that any actual inventor would know. She confused cross-linking mechanisms, misdescribed the reaction conditions, couldn't explain why certain stabilizers were necessary. Patricia let her dig herself deeper, asking follow-up questions that exposed the gaps in Rebecca's understanding. I watched Rebecca's confidence crumble in real time. This was the woman who'd controlled my career for 3 years, who'd convinced me to trust her with my work, who'd made me doubt whether I even deserved credit. And she couldn't answer basic questions about the technology she claimed to have invented. "Let me ask you directly," Patricia said. Rebecca hesitated, her eyes darting to Westbrook. "That's not what your patent application says." "Did you tell the patent attorneys that, Dr. O longer hesitation?" "That's not an answer to my question," Patricia said, her voice sharpening like a scalpel. "Did you tell them, Doctor?" Rebecca looked at Westbrook, who was suddenly very interested in his notes. "Doctor, I directed the research," Rebecca said, her voice rising defensively. "That's still not an answer. We have documentation showing Dr. Okafor developed every major technical component. We have testimony from other researchers, including Dr. Jennifer Lin and Dr. Marcus Thompson, describing a pattern of intellectual property theft spanning nearly a decade. We have emails proving Dr. Okafor explained these concepts to you after she'd already solved them. We have lab notebooks showing she worked alone during every major breakthrough. So I'll ask one more time. Did you invent this technology, or did you steal it from Dr.?" Rebecca's lawyer put his hand on her arm, but she shook him off. "I built my career on innovative research," she said, anger finally breaking through her composure. "I've published dozens of papers, secured millions in grant funding. I've trained dozens of students." "That's fascinating," Patricia said, "because we've found 3 other researchers whose work you've claimed as your own over the past 8 years. The deposition ended shortly after. The university's investigation concluded 4 weeks later. The ethics board found substantial and convincing evidence that Rebecca had systematically misappropriated my intellectual work and filed a fraudulent patent application. Her NIH funding was suspended pending federal review. Her tenure was revoked. Her position at Georgetown was terminated effective immediately. The university offered me a settlement, $12 million, full patent rights transferred to my name, and a formal public apology acknowledging my sole inventorship. They were desperate to avoid a federal trial that would expose not just Rebecca's misconduct, but their failure to detect a pattern of theft that had spanned nearly a decade. Patricia negotiated for more. We got $15 million as a public acknowledgement of my sole inventorship published in Science and Nature, a provision that Georgetown would establish an intellectual property protection program for junior researchers, and a requirement that Rebecca's previous publications be investigated for similar misconduct. The university agreed to everything. Meridian Pharmaceuticals came back to the table 3 weeks later, this time negotiating directly with me. We structured a licensing deal that gave me ongoing royalties and control over development decisions. They also agreed to name the device after me, ensuring that every patient who used it would know who'd actually invented it. The device is now in phase 3 clinical trials, on track to help millions of people manage diabetes more effectively. Rebecca's lawyer tried to negotiate a non-disclosure agreement as part of the settlement. Patricia and I refused. What happened to me, and to Jennifer Lynn and Marcus Thompson, needed to be public. Other young researchers needed to know what to watch for, needed to understand that this kind of theft was fightable. 6 months after the settlement, I established the Okafor Foundation for Research Integrity. We provide legal resources for junior researchers facing intellectual property theft, maintain a confidential database of misconduct patterns, and advocate for policy changes in how universities handle attribution disputes. Jennifer Lynn serves on our board. Marcus Thompson came back to research, joining a startup that's commercializing his drug delivery work under his own name. They both say that finally getting justice, even years late, gave them back something they'd thought was lost forever. Rebecca tried to find another academic position. No university would hire her. The patent fraud and the investigation became part of her permanent record, searchable by anyone who cared to look. The story was covered in Science, Nature, and the Chronicle of Higher Education. Last I heard, she was working as a consultant for a medical device company. The kind of job you take when your research career is definitively over. I still work late nights in the lab, but now it's my lab, with my name on the door and my ideas protected by patents with my name in the inventor field. I've hired 3 junior researchers. Brilliant people from underrepresented backgrounds who remind me of myself at their age. I make sure they understand intellectual property protection. I make sure they get credited for their work. I make sure they know that their ideas belong to them, that mentorship doesn't mean ownership, that collaboration requires consent. Sometimes I think about the woman I was 3 years ago, so desperate to believe that talent and hard work would be enough, so willing to trust someone who seemed to believe in me. I don't regret that trust entirely. It taught me something valuable about protecting yourself without becoming cynical, about fighting back without losing your sense of purpose. The insulin delivery device launched commercially last month. It's called the Okafor Insulin Management System. My name, not because I need the recognition, but because every young researcher who sees it should know that your work belongs to you, that stealing someone's innovation isn't just wrong, it's fightable. And because somewhere, a brilliant junior researcher who's being told to trust their mentor, to focus on science instead of credit, to believe that recognition will come if they're just patient enough. That researcher needs to know that when someone steals your work, you can take it back. You just have to be brave enough to fight for what's already yours.